Depression is more than just feeling sad. It's a deeply disruptive mental health condition that affects how a person thinks, feels, and functions. Among its various forms, Major Depressive Disorder, MDD, is the most recognized and widely diagnosed. It's projected to become the leading cause of disease burden globally by the year 2030. The term Major Depressive Disorder was coined in the 1970s and later formalized in the 1980s with its inclusion in the Diagnostic and Statistical Manual of Mental Disorders, DSM. The most current version, DSM-5, outlines 9 key criteria used to identify this condition. Central to the diagnosis are 2 hallmark symptoms: a persistently low or irritable mood and anhedonia, which refers to the loss of interest or pleasure in previously enjoyable activities. For a diagnosis to be made, at least one of these must be present. In addition to those core symptoms, several others round out the diagnostic picture. These include significant changes in weight, either gain or loss, disruptions to sleep patterns, insomnia or hypersomnia, and daily fatigue or persistent lack of energy. Psychomotor changes, where physical and mental activities slow down noticeably, can also be a red flag. Other important indicators are feelings of worthlessness or excessive guilt, difficulty concentrating or making decisions, and recurrent thoughts of death or suicidal ideation. A person must exhibit at least 5 of these symptoms consistently for a minimum of 2 weeks, and they must interfere with daily life. These symptoms cannot be explained by substance use or another medical condition. The origins of MDD are complex, involving a mix of genetic predispositions and environmental influences. Twin studies reveal that up to 40% of the variability in depression risk can be traced back to genetics, making family history a significant risk factor. External influences such as traumatic experiences, ongoing stress, childhood abuse, or serious medical illnesses can also contribute to the onset or worsening of depression. However, these external factors are considered contributors rather than direct causes. One helpful way to understand this is the diathesis stress model, often visualized using 2 cups. The idea is that some people are more vulnerable due to their genetics or life experiences. So when stress is added, they overflow, meaning they develop depression, while others may not. The science behind what causes depression is still evolving, but there are several leading theories. The monoamine hypothesis suggests that depression stems from imbalances in brain chemicals like serotonin, dopamine, and norepinephrine. While there's some evidence supporting this, the theory isn't perfect. Healthy people with low serotonin don't always develop depression, and antidepressants that correct these imbalances often take weeks to start working. Other theories focus on hormonal systems like the hypothalamic pituitary adrenal HPA axis, where patients often show increased cortisol levels and altered stress responses. There are also possible connections between depression and abnormal thyroid or growth hormone levels. Additionally, some researchers believe the immune system may play a role, citing elevated cytokines and promising responses to anti-inflammatory treatments. These insights also help explain why depression is often linked to immune-related conditions such as asthma. Statistically, around 12% of people, roughly 1 in 8, will experience major depressive disorder at some point in their lives. Women are nearly twice as likely as men to be affected, possibly due to hormonal differences and unique life stressors, although precise reasons remain uncertain. While the average age of onset is about 40 years old, mental health professionals are observing rising rates of depression in younger age groups. In terms of diagnosis, clinicians often rely on the DSM-5 or the ICD-11, commonly used in Europe. Tools like the Patient Health Questionnaire 9, PHQ-9, help assess the severity. MDD is rarely an isolated condition. It's frequently found alongside anxiety, substance misuse, particularly alcohol, chronic pain, and even conditions like ADHD and PTSD. Treating major depressive disorder effectively often requires a multifaceted approach. One of the first steps is addressing lifestyle factors: regular physical activity, improved diet, better sleep hygiene, avoiding drugs and alcohol, and creating daily routines can all make a difference. Psychotherapy, often referred to as talk therapy, includes evidence-based approaches like cognitive behavioral therapy, CBT, and interpersonal therapy, IPD. These are not only effective for many patients, but are the recommended first-line treatment for those under 18, according to guidelines such as those from NICE in the UK. When therapy alone isn't enough, especially in moderate to severe cases, medication may be introduced to the treatment plan. Pharmacological treatments vary, but SSRIs, like sertraline, fluoxetine, or citalopram, are typically prescribed first due to their favorable side effect profiles. For patients with coexisting chronic pain, SNRIs like duloxetine and venlafaxine may be more suitable. Atypical antidepressants, such as mirtazapine, are often chosen for those who need help with sleep or appetite. Older medications, including tricyclic antidepressants and monoamine oxidase inhibitors, are less commonly used due to their higher risk of side effects, but they remain options in resistant cases. Recent studies suggest that vitamin D supplementation may benefit patients who are deficient, and even anti-inflammatory medications like COX-2 inhibitors, e.g. celecoxib, have shown promise. One of the most powerful tools in treating severe or treatment-resistant depression is electroconvulsive therapy, ECT. Often misunderstood, ECT involves safely inducing controlled seizures under general anesthesia with muscle relaxants. Despite its dramatic reputation, it is considered the most effective therapy for major depressive disorder, with a success rate of about 50% among patients who haven't responded to other treatments. However, relapse is a significant concern, with about half of those who initially benefit from ECT experiencing a return of symptoms within a year. Nonetheless, ECT remains a vital option for those facing the most persistent and debilitating forms of depression.